Now at 5:30, long-term care's long-term crisis. The worker shortage is nothing new to Florida nursing homes and assisted living facilities. Thank you for joining us. I'm Ava Van Valen.
And I'm Channing Frampton, but now the situation has become so dire. Some facilities are not taking in new residents, while others are being forced to limit visitation.
Our investigative reporter Katie LaGrone tells us what some facilities are doing to fill the vaccines.
Florida nursing homes and assisted living facilities are in desperate need of help, human help. The industry, which has long suffered from an employee shortage and quick worker turnover, describes its worker shortage as its #1 concern right now, after a year of crisis.
Honestly, I think COVID has just worn all of us out.
Burnout, coupled with competition from government unemployment benefits, among the reasons industry experts say long-term care employees are walking out the door in droves.
Managers are stepping in to cover shifts, looking at the potential for burnout pretty quickly. It's not a sustainable position right now.
The result is leaving some facilities turning people away, from nursing homes freezing new admissions to others restricting visitation.
Why do I need an appointment? Why is it limited to 30 minutes?
Rob Zerwell's loved one just moved into a nursing home on Florida's East Coast. He has yet to visit. The center is limiting visitation from when to how long they can stay, and everyone has to book visits in advance. Zerwell tells us even his loved one's daily aid was turned away.
To have our caregiver turned away and told your visitations are only be allowed for a small period of time, that's not what they're paid for. They're paid to be there for 8 hours.
A spokesperson from the facility's parent company told us in this email, while they are meeting or exceeding state staffing ratios to meet the CDC's requirement for safe visitation, additional staffing resources are needed and only available during limited hours. Desperate to hire, some facilities are now offering sign-on bonuses, more hourly pay, while others are resorting to staffing agencies just to fill the jobs inside. The state's Nursing Home Association calling it a huge challenge since nursing homes are government funded, limiting their ability to raise costs. What the shortage does to resident rates in assisted living centers remains unknown. For now, the priority is finding care in an industry where care can't stop.
We don't have the option of reducing our operating hours.
Also contributing to the shortage, nurses who are retiring and others who are leaving healthcare altogether due to burnout from the pandemic. Katie LaGrone, ABC 27, investigates.